Hello.
Hi.
My name is Christina Wilkerson, and I'm a nurse practitioner student with Herzing University, and I will be tending to you today.
Okay.
And your name is?
Patricia Bohannon.
Hey, Patricia.
Hi.
Okay, what brings you here today?
I'm here for my wellness visit.
Wellness, okay. Do you have any acute illnesses or concerns that we need to address today?
No.
Okay. All right, well, let's get started. Do you have any allergies?
Yes, to sulfa.
Okay, what does sulfa drugs do to you?
A red blotchy rash.
Okay. All right, are you on any medications?
No, just a prenatal.
And you're on a prenatal, are you pregnant?
No, I'm not pregnant, but it's for trying to get pregnant.
Okay. All right, do you have any current diagnoses?
Mm-mm.
Any surgical history?
I have my wisdom teeth removed and a dermoid removed off my right ovary.
Okay. Are you up to date on your vaccines?
Yes, and I got my flu shot.
Okay, do you smoke?
No.
Do you drink?
No.
Any recreational drugs?
No.
Any suicidal or homicidal thoughts?
No.
Okay. Are you married?
Yes.
Okay, any kids?
No.
Okay, and do you work?
Yes, I'm a nurse.
You're a nurse? Okay, good. All right, can you give me a little history about your mother's and father's health?
My mother's healthy, no blood pressure, heart, lung, cholesterol issues. My dad's healthy as well.
Okay, and your grandparents?
My paternal grandfather died of prostate cancer. My paternal grandmother died of a heart attack. Maternal grandmother is living. Maternal grandfather died of leukemia.
Okay. All right, so I'm going to ask you a few questions just for a review of symptoms, just to see where you are today, okay? All right, have you had any trouble seeing lately? Any double vision, any blurred vision, any drainage from your eyes? Okay, what about hearing? Any problems hearing? Any drainage from your ears? Any problems with smelling? Any drainage from your nose?
No.
Okay, what about swallowing? You do okay swallowing?
I swallow just fine.
Okay, have you noticed any dryness of the mouth, any lesions or sores? Okay, any dizziness on walking?
No.
Steady gait?
Yeah.
Have you noticed any recent weight loss or gain?
No.
No. Okay, you urinating okay?
Yep.
You feel like you empty your bladder when you go?
Yep.
Okay, are you defecating on a normal? Okay, any constipation or diarrhea? Any nausea or vomiting? Okay, when you're doing your activity of daily living, are you able to do that without being short of breath? Able to walk extended ways without shortness of breath?
Yes.
Okay, and what about your heart? Any palpitations that you notice, increased heart rate? Any swelling of your extremities or anything, lower or upper? Okay. All right. Well, with that said, we're going to move along with the exam.
Okay.
It's going to take a few minutes.
Okay.
But we're going to start with your skin.
Okay.
Look at your hands. The color is consistent with her race. The contour is smooth. There are no lesions or bumps. Her nail beds has no cracks in it. They are not brittle. And the turgor is good. All right. All right. I'm also, I'm going to take your blood pressure.
Okay.
Okay, and your heart rate. How tall are you?
I'm 5'6".
Okay, and do you know how much you weigh?
I weigh 125 pounds.
Okay. Blood pressure is 118/76. Respirations are 18 with a heart rate of 68. Next, I will assess your face and your head. We're gonna look at cranial nerve 7. As you can see, she's able to blink her eyes spontaneously without difficulty. Can you smile for me? And this shows that her cranial nerve 7 is intact. And then we'll check your head. It's round and smooth. There's no bumps or nodules. Her scalp and hair is clean and free of any debris. I'm able to palpate her occipital nose. Is there any tenderness?
No.
Okay, I will check your temporal arteries. There are 3+ equal bilaterally. Any tenderness on your maxillary sinuses?
No.
What about your frontal sinuses? Any?
No.
Okay. All right. So next I will check the patency of her nose. If you would just press one side and blow out. Right in there. Okay. I'm also going to check for septum deviation. And there's no deviation notice, and her passages are clear. I'm going to ask you to close your eyes, and I'm going to ask you what you smell.
Vanilla.
Yes. Next, I will do an assessment of your mouth. Her lips are moist and pink, so it's her vocal mucosa. Her teeth are intact, they're not chipped, and her gums are pink and moist. I'm going to check her cranial nerve 9 and 10, which is her uvula. Can you say ah?
Ah.
Let me get a little light here. Say ah. The uvula is midline and intact. There's no redness, erythema, no edema. Her tonsils are also visualized. There's no redness or edema. We're going to check cranial nerve 12 by her moving her tongue in different directions, and as you can see, her cranial nerve 12 is intact. Next, I will check her eyes, the outer structure of her eyes. The eyelids are not drooping. The eyes are symmetric. Her sclera is white, and her conjunctiva is intact and pink. Okay, I will check her cranial nerve 2. I'm going to have you look at the Snellen chart. Cover one eye at a time and tell me what you see.
P, F, C, D, T, Z, L. P, F, C, D, T, Z, L.
Correct. Good job. Next, we're going to check your extraocular motion, muscles, of the eye. I'm going to make, and it's going to check cranial nerves 3, 4, and 6. I'm going to make an H.
Okay.
And I want you to move your head, just follow my finger.
Okay.
All right. Next, we will check the close-up position of gaze.
Okay.
Okay, I want you to look at my finger.
Okay.
All right, and just follow without moving your head. Okay. All right, that is intact. Next, I'm going to look and do a fundoscopic exam on her eyes and look at the optic nerve. The optic nerve is intact and there's no hemorrhage noted. Lastly, or not lastly, but I'm also going to do a corneal light reflex on her eyes. I'm going to have you gaze out into the wall right there And I'm going to gaze the light into your eyes. Okay, and there's no dysymmetry noted. I'm also going to check her for Perla. And her pupils are equal, round, react to light, and are accommodating. All right, next we're going to do a little ear exam. All right. As you can see, her ears are equal and symmetric. Any tenderness?
No.
Okay. Look at the ear. Okay. Okay, the ear canals are free of cerumen bilaterally, and the tympanic membranes are visualized. They are intact. There is no redness or edema or exudate noted. I'm going to do a quick voice test. What I'm going to have you do is cover one ear at a time, starting with your right ear.
Okay.
And I'm going to whisper a few words, letters, or alphabets, and have you respond. Okay? Or repeat rather. A, B, C.
A, B, C.
1, 2, 3.
1, 2, 3.
Okay. A, B, C.
A, B, C.
Do, re, mi.
Do, re, mi.
She was able to hear it equally. Any issues?
No.
Okay. And other tests that you can do to check for auditory loss would be the Weber's test and the Renan's test. If I were to do the Weber's test, I would have a tuning fork and I would place it to the top of her head. I would have her signal me when she no longer hears it. If it stops equally at the same time, there is considered no hearing loss. If there's some type of unilateral loss where she stopped hearing it in one ear versus the other sooner, then further testing is needed to decipher how bad the hearing loss is. The Renan's test, I would take the tuning fork and put on a mastoid bone. Once she tells me she can no longer hear it, I will place it by the ear canal, and she then again would tell me if she can hear, when she's no longer able to hear it, and that too checks for hearing loss. Yeah. Okay, next we will go to the throat, the neck rather. All right, the neck is round, palpating the cervical nodes and occipital nodes again as well. Any tenderness anywhere?
No.
Okay, I'm gonna palpate the carotid arteries. They're 3+, equal bilaterally. The trachea is midline and intact, and the thyroid is palpable. Any tenderness?
No.
I'm going to check for cranial nerve 11, and I'm going to have you shrug your shoulders up, turn to your right, turn to your left. As you can see, cranial nerve 11 is intact. I'm going to go on to listen to the respiratory system. If you can sit up for me, please. Can you take a deep breath in, deep breath out? Okay, the rise and fall of the chest was equal bilaterally. Expansion was well. I'm going to take a listen. Lung sounds are clear bilaterally. I'm gonna percuss the back, posterior lungs, fields, I'm sorry. Resonance is noted among all the lung field. I'm gonna feel my hands on you, and I'm gonna ask you to say 99.
99, 99, 99.
Okay. Equal moderate vibration is heard upon her speech. And I'm gonna check the costo vertebral angle for tenderness. Any tenderness?
No.
Any tenderness?
No.
Okay. I'm gonna move ahead to the anterior portion of the exam. Gonna take a listen at you. Deep breath. Deep breath. Lungs are clear to auscultation bilaterally. I'm gonna percuss now. And resonance is heard over the lung fields. Can you say 99?
99, 99, 99.
Okay. And vibration is felt equally and moderately upon his speech. Next, I will listen to the cardiovascular system. S1 and S2 is noted. I listen to the apical pulse at the fifth intercostal space, mid-clavicular line. Pulse rate is 68 and regular. I'm now going to check her radial pulses and her brachial pulses. Her pulses are intact, equally bilaterally, 3+. I'm going to check your brachial. Her brachial pulses are equal bilaterally intact, 3+. Okay. We're gonna move right along. I'm actually gonna get you to lay back for me.
Okay.
And have you look that way. And as you can see, or I can see, there is no jugular vein distension, as the jugular vein is flat and not bulging. Now I'm going to take a listen at your abdomen. Okay, bowel sounds are active times 4 quadrants, and I will now percuss the 4 quadrants. Dullness is heard upon all 4 quadrants. Now I'm going to palpate for the liver. Let's see what we can see. I'm able to feel the edge of the liver. It is smooth and soft. Now we'll go over and try to palpate the spleen. I'm unable to palpate the spleen. Now I'll try to palpate the kidney on the left side. I'm unable to palpate the kidney on the left side. Now we'll try to palpate the kidney on the right. And I'm unable to palpate the kidney on the right. Not being able to palpate the kidneys or the spleen is normal finding in adults. While you're laying, I'm just going to feel your popliteal. Okay, bend your leg just a minute. I'm able to palpate her pulses equally bilaterally. Yeah. Next, I'm going to check some your range of motion with some things, okay? I want you to shrug your shoulders out. You can hold them out there. Let's check in C5. Okay, you know that. Can go. Okay, C6, C7. Good deal. Can you do that? Travel it up. Now, and check in C8. All right. So now I'm going to move down to your pulses on your feet. I'm going to check her dorsalis pedis. There are 3+ equal bilaterally, and I would check her tibial, posterior tibial pulses. They are equal bilaterally, 3+. And I'm also going to check for pre-tibial edema. And there is none. Her legs are smooth and they're free of hair. Next, I'm going to check the range of motion of her lower extremity. Can you push up your knees against my legs if you have to push up some? Can you raise your leg? Okay. Can you extend your leg? Can you push down? Okay. Can you push up? Now we'll check for abduction and adduction. Abduction. Adduction. Okay. Right. I'm also going to have you stand for a moment. I'm going to check your spine.
Okay.
Any tenderness?
No.
Okay. All right. Now I'm going to have you demonstrate for me walking from heel to toe.
Okay.
Okay. If you can do that. The camera, I'm trying to get in the camera. And she's able to do it. Can you walk on your heels for me? Okay, what about your tippy toes? Okay. Okay, now I want you to close your eyes.
Okay.
Put your feet together.
Okay.
And she has good balance. All right. I'm gonna have you sit for me. Okay, I'm gonna have you close your eyes, and I'm gonna touch your face,
Okay.
your hands, your arms. So I need you to expose your arms, your legs, and your feet. And I want you to be able to tell me if the object is sharp or dull.
Okay.
Can you close your eyes for me, please?
Sharp. 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 Sharp.
Sorry.
Sharp. 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 Dull. 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 Dull.
Awesome. Alright, if you would keep your eyes closed,
Okay.
and I will check your sense of position. I'm gonna feel my hand. That spelling chart fell again. Sorry. Can you tell me if I'm pulling your finger upward or downward?
Up, down, up, down, down, up, down.
Good. Next, I'm going to check for sterignosis. If you close your eyes, I'm going to place an object in your hand and would like for you to tell me what object I'm placing in your hand.
Is it a quarter?
It is.
A paper clip?
Yes. Okay. Next, I'm going to check your reflexes.
Okay.
All right.
Do I have bad reflexes?
Oh, I'm just trying. I'm gonna keep going. There we go.
Yeah.
2 plus.
Hit it harder.
2 plus. Next, I'm gonna check your I don't know if they can see. All right. There was flexion of the arm and the contraction. There was flexion of the arm and contraction. I have to go here. Good. Good. Okay. I will check your cerebellar function.
Okay.
I'm gonna have my finger here, and you're gonna go from my finger to your nose.
Okay.
All right, good deal. All right, do you have any questions or concerns for me that you can think of?
Nope.
All right, so I want to talk to you a little bit about breast self-exams.
Okay.
Okay, normally they're done monthly.
Okay.
You know, now it's not a test that is designed to say if you have cancer.
Mm-hmm.
There are other tests that test for that, like mammograms.
Okay.
But it is advised that you check your breasts at least once a month
Mm-hmm.
for any abnormalities,
Okay.
any discharge from the nipple, any changes in the nipple, any changes in the contour of your breast, enlargement,
Mhm.
you know. And we want to check those things so that we can let our physicians know that there is a change,
Okay.
you know, and if there's a nodule that wasn't there before, that's something that your physician should know.
Okay.
And if he feels that there's any further evaluation that's needed,
Mm-hmm.
you'll be able to give him that information. And I do believe that's one of the benefits of still doing breast self-exams. Now, someone say it's not necessary because it doesn't stop or prevent cancer from happening. However, it does alarm you that something is different in your body. So these are things that you can check while you are in the shower or while you're laying in bed. You can go in a circular motion to the outer region of your armpit, and you
Okay.
check for nodules or hardenings, or if it's moving or not moving. You know, those are things that you should report to your physician.
Okay.
All right. Do you have any problem with any access to health care?
No.
Yeah. You have a way to your appointments. You have insurance that can cover your.
Yes.
Okay. All right. Good deal. All right. Well, I thank you for seeing me today. make sure you follow up with us in about a year, or
Okay.
if not 6 months,
Okay.
or sooner if you have any needs or concerns, okay?
Okay.
All right, thank you
Thank
for
you.
allowing me to see you.
Thank you.
Thank you.